IMANE LOUANJLI, clinical psychologist from Morocco. Welcome to the second annual Congress of MSERM.
Thank you for having me.
We are here in the beautiful city of Fez, and we are going through the Congress, and we are taking advantage of this moment to ask you a few questions. So my first question will be, how does endometriosis affect women's mental health?
So endometriosis affects mental health in many ways. The first impact is stress, because it's stress about how are we going to be able to manage our pain in public places, family gatherings, social events. It's a pain that other people don't understand because it's an invisible pain. It's a pain we don't see. So the stress will impact on work, on social life, on gathering, which is going to lead us to anxiety, to a depression, to constant need of medical interventions. And sometimes women, when they are in social gathering, they need to go outside or take a deep moment to relax, to take some medications, which can a little bit indicate them into their daily life.
Absolutely, thank you. So from this perspective, how can we offer a multidisciplinary care to the patients who have been diagnosed with endometriosis, and why do you think this is important?
So why is it important? Because we tend to go from the medical side. So it is important to treat the symptoms of endometriosis in the medical side, through surgeries, through treatment, through gynecological appointments. But it's also important to give them tools they can use in their daily life to help them better manage their quality of life. Like we said, for example, in terms of sleep, in terms of energy, in terms of how can we manage our mood during the day, or how can we manage any stressors or triggers, and what can we do with it? Because the most complaint of women is, for example, if she goes to a doctor office, he gives her pain to relieve the symptoms, it works a little, and then the pains come back. And then it puts them into a vicious circle. So this is where it's important to intervene, to help her manage both the pain of the symptoms, but also how to manage her quality of life in terms of sleep, in terms of having a normal life like other people do.
So this is a strong message for women who suffer from endometriosis. We are very pleased to have you here with us.
I am pleased to be here.
Hope to see you again in the next annual Congress of MSERM.
Thank you for having me.
Thank you very much.
Of course, you're welcome.
Thank you.
You're welcome.